Norethindrone and ethinyl estradiol are the two hormones found in Norethin-Eth Estra-Ferrous Fum Tablet, which is used to prevent pregnancy. The 7 inactive tablets taken during the 4th week contain a small amount of iron, ferrous fumarate, but do not contain any hormones. These tablets are meant to help you stay in the habit of taking one tablet each day. It's important to note that the iron in these tablets is not enough to treat iron deficiency. In addition to preventing pregnancy, this medication can also help make your periods more regular, decrease blood loss and painful periods, decrease your risk of ovarian cysts, and treat acne. However, it's important to remember that using this medication does not protect you or your partner against sexually transmitted diseases. When taking Norethin-Eth Estra-Ferrous Fum Tablet, it's important to follow the instructions and take it at the same time every day. This will help maximize its effectiveness. As always, it's best to consult with your healthcare provider to determine the optimal timing for taking this medication. Before taking norethindrone, ethinyl estradiol, ferrous fumarate, read the patient information leaflet provided by your pharmacist. This leaflet contains important information on when to take your pills and what to do if you miss a dose. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth as directed by your doctor, usually once daily. It's important to take it at the same time each day, so pick a time that is easy for you to remember. If you are taking the chewable tablet, you can either swallow it whole or chew it thoroughly and then swallow. It's crucial to continue taking this medication exactly as prescribed by your doctor. Do not skip any doses. If you experience vomiting or diarrhea, you may need to use a backup birth control method. You can take this medication after your evening meal or at bedtime to help with any stomach upset or nausea. Or you can choose a different time of day that is easier for you to remember. Your pill pack contains 21 pills with active medication and 7 reminder pills with iron. Take 1 active pill once daily for 21 days, followed by 1 inactive pill with iron once daily for 7 days. You should have your period during the 4th week of the pack. If you are also taking certain medications that can interact with iron, ask your doctor if you should skip the reminder pills. If this is the first time you are using this medication and you are not switching from another form of hormonal birth control, start taking the first tablet on the first Sunday following the beginning of your menstrual period or on the first day of your period. During the first cycle of use, use an additional form of non-hormonal birth control for the first 7 days to prevent pregnancy. If you start on the first day of your period, you do not need to use backup birth control the first week. Consult your doctor or pharmacist for information about how to switch from other forms of hormonal birth control to this product. If any information is unclear, consult the patient information leaflet or your doctor or pharmacist. Some common side effects of Norethin-Eth Estra-Ferrous Fum Tablet may include nausea, vomiting, headache, bloating, breast tenderness, swelling of the ankles/feet, or weight change. You may also experience vaginal bleeding between periods or missed/irregular periods, especially during the first few months of use. If any of these effects persist or worsen, please consult your doctor or pharmacist immediately. It's important to note that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential side effects. Most people using this medication do not experience serious side effects, but it may raise your blood pressure, so be sure to monitor it regularly and inform your doctor if the results are high. Contact your doctor immediately if you experience any serious side effects, such as lumps in the breast, mental/mood changes, severe stomach/abdominal pain, unusual changes in vaginal bleeding, dark urine, or yellowing of the eyes/skin. In rare cases, this medication may cause serious problems such as blood clots, so seek medical help right away if you experience symptoms such as chest/jaw/left arm pain, confusion, sudden dizziness/fainting, or difficulty speaking. Allergic reactions to this drug are rare but can be serious. Seek medical help if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you experience any other effects, contact your doctor or pharmacist. And remember, if you're in the US or Canada, you can report any side effects to the appropriate health authority. If you're over 35 years old and smoke cigarettes, it's important to avoid using Norethin-Eth Estra-Ferrous Fum Tablet, as it can increase your risk of stroke, heart attack, blood clots, and high blood pressure. This risk becomes higher as you get older and smoke more cigarettes. It's crucial to keep this medication out of reach of children, as accidental overdose of iron-containing products is a leading cause of fatal poisoning for children under 6 years old. If an overdose does occur, seek medical help immediately or call a poison control center. When taking Norethin-Eth Estra-Ferrous Fum Tablet, it's important to follow the dosage instructions provided by your healthcare professional. This medication is commonly used to treat iron deficiency and anemia, as it helps to increase the levels of iron in the body. It is usually taken once daily, with or without food. It's best to take it at the same time each day to help you remember. Remember not to take it with antacids, dairy products, tea, or coffee, as they can decrease the absorption of iron. Be sure to talk to your doctor about the best time for you to take this medication based on your individual needs. Before taking Norethin-Eth Estra-Ferrous Fum Tablet, it's important to let your doctor or pharmacist know about any allergies you may have to ethinyl estradiol, norethindrone, ferrous fumarate, or other similar products. This medication may also contain inactive ingredients that could cause allergic reactions, so it's best to discuss this with your pharmacist. It's also important to inform your doctor or pharmacist about your medical history, especially if you have a history of blood clots, high blood pressure, abnormal breast exams, cancer, high cholesterol, depression, diabetes, heart problems, kidney or liver disease, obesity, stroke, thyroid problems, or if you have had surgery recently or will be confined to a bed or chair for a long time. This medication may also affect blood sugar levels, so it's important to monitor this regularly and inform your doctor of any changes. Additionally, Norethin-Eth Estra-Ferrous Fum Tablet may cause skin discoloration, so it's important to limit sun exposure and use sunscreen. If you wear contact lenses, you may also experience vision problems, so it's important to contact your eye doctor if this occurs. It's also important to note that this medication may take longer for you to become pregnant after you stop taking it, and it should not be used during pregnancy. If you become pregnant or think you may be pregnant, it's important to notify your doctor immediately. This medication may also decrease breast milk production, so it's important to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions when taking Norethin-Eth Estra-Ferrous Fum Tablet. Some products that may interact with this drug include aromatase inhibitors, fezolinetant, aspemifene, tamoxifen, tizanidine, tranexamic acid, and certain combination products used to treat chronic hepatitis C. Additionally, some drugs may cause hormonal birth control to work less effectively, potentially leading to pregnancy. Examples of these drugs include griseofulvin, modafinil, rifamycins, ritonavir, St. John's wort, drugs used to treat seizures, and HIV drugs. It's important to inform your doctor when starting any new medication and discuss whether additional reliable birth control is necessary. It's also important to note that this medication may interfere with certain lab tests, potentially causing false results. Be sure to inform lab personnel and all your doctors that you are taking Norethin-Eth Estra-Ferrous Fum Tablet. If you or someone else has taken too much norethindrone acetate, ethinyl estradiol, and ferrous fumarate, and you have severe symptoms like passing out or difficulty breathing, call 911 immediately. Otherwise, contact your local poison control center right away. In the US, you can call 1-800-222-1222, and in Canada, you can call your provincial poison control center. Symptoms of an overdose may include severe nausea and vomiting, as well as sudden or unusual vaginal bleeding. Always seek medical help if you suspect an overdose. It's important to remember not to share this medication with others. Make sure to schedule regular complete physical exams that include lab and/or medical tests such as blood pressure, breast exam, pelvic exam, and pap smear while you are taking this medication. Follow your doctor's instructions for examining your breasts, and report any lumps right away. It's important to keep all medical and lab appointments. If you have any concerns or need more details, make sure to consult your doctor. If you miss a dose, refer to the product package information for advice. You may need to use backup birth control to prevent pregnancy. If you often forget to take your pills as directed, contact your doctor to discuss switching to another form of birth control. When storing Norethin-Eth Estra-Ferrous Fum Tablet, it's important to keep it at room temperature, away from light and moisture. Avoid storing it in the bathroom, and always keep it out of reach of children and pets. When it comes to disposing of this medication, do not flush it down the toilet or pour it into a drain unless specifically instructed. Properly discard the product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this properly. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.